Hi, it's Dr. Mike, and today's video is called Fibromyalgia Medical Term Definition. Basically, I'll be talking about how they came to that medical term definition, and I'll be giving you a little bit of a rundown of some of the basics of this definition and condition. And at the end, I'll also show you some of the points where you can kind of figure out whether you might have this or not. But before we get started, please note that this presentation is not intended to provide individual medical patient advice, but rather as a way of providing education about fibromyalgia. If you think you have a condition that is causing you chronic pain, please talk to your doctor and get a proper diagnosis and treatment plan. So, fibromyalgia medical term definition. If you break it up into little pieces, the first part, fibro, derives from the Latin word fibro, which means fibrous tissues. And fibrous tissues are basically the dense connective tissues that are made up of collagen fibers. And when you're thinking of, muscles and tendons and connective tissue areas where it's a little bit kind of harder and denser tissues in your body. The second part of the word myalgia basically means muscle pains and aches. Algia is generally basically comes from Latin for pain, and so fibromyalgia, the actual term, means medical pains within the fibrous tissues. So the reason that they came up with that term, and it was from kind of around the 1990s when they started defining the syndrome, was that the cardinal symptom of fibromyalgia is widespread body pain. So, and basically with that, they find these little focal areas of, they call them hyperalgesia, meaning it's really like oversensitive or over painful tender points in your body. And if we start to look at these points, you can see that it basically impacts the entire body, and it's kind of a chronic pain disorder, meaning that it's been there for longer than 3 months. It's also often accompanied by fatigue, sleep, memory, and mood issues. So fatigue meaning waking up really tired, just constantly being exhausted, and then having really poor quality sleep, where you either keep waking up or you can't fall asleep properly, but the quality of the sleep is generally not as good, and you don't get into those deep phases of REM sleep that you need to recharge your batteries. And then memory and mood issues often relate to kind of a fogginess where it's difficult to concentrate. Sometimes you can forget a lot of things, or have issues coming up with certain kinds of words or places or things like that. So it's thought that fibromyalgia alters the way the neurological system processes pain, and this causes painful feelings to be amplified. So they call it a central sensitization state, meaning that normal movements and stimuli coming from your nerves around your body, instead of just being normal stimuli, they are interpreted as pain, and the way your brain and nervous system works, it seems to be a little bit out of balance. Some of the neurotransmitters are also found to be out of balance. So if we look at the picture here on the right, basically these are the defined points that you're going to find in fibromyalgia sufferers. So these points can be mild to severe, and they call it the widespread pain index, or the widespread index, basically because you can see all these little red dots all over the place spread throughout the body are the typical kind of tender points. So a lot of the times when your therapist or doctor examines you, they'll be pushing on these points to determine kind of whether you have mild to severe pain. Normally it might be slightly uncomfortable, but normally these points should not be painful. So the diagnostic criteria have changed over the years. In the beginning, when they diagnosed fibromyalgia, they looked at these 19 points. So if you add all of these up, it's 19 points. And when they pushed on all these points, if you had more than 11 of these 19 points that were painful, then you were diagnosed with the condition. The diagnosis seems to be changing to consider some of the other symptoms as well, but I'll get more into that into some of the other videos. So yeah, now definitely the main 4 symptoms are pain, fatigue, waking unrefreshed, and cognitive symptoms. So hope you enjoyed that explanation of the medical term definition. And yeah, I've got a couple of videos in the series. The next one will be the pressure points for the fibromyalgia test, where I'll go a little bit more into detail about these points, what they mean, where they are. I do have a 10-part series that you can check out. And there should be a link either in the description or in the comment section. And please feel free to comment or like or subscribe to the channel. Thank you.